There's a moment, quiet but unforgettable, when you realize your knees no longer move as they used to, not from a long hike or years of wear, but from something more profound. The ache isn't just soreness. The stiffness doesn't ease with rest. The swelling, the grinding, the unpredictability, it's not just aging, it's rheumatoid arthritis. And when it strikes your knees, it does more than slow you down. It steals your confidence, freedom, and sense of control over your body. For those over 60, this isn't just inconvenient, it's dangerous. One wrong step, one fall, and life changes in an instant. But here's what most people don't know. You're not powerless. You don't have to surrender your mobility or your independence. In this video, we'll walk you through a practical roadmap to protect your knees, reduce pain, strengthen your muscles, and move through life with more stability and strength. These are proven tools, not empty promises, designed for real people facing challenges. Because your knees may be hurting, but you still have places to go, and we're here to help you get there. Rheumatoid arthritis doesn't just hurt your knees, it attacks their foundation. Unlike typical wear and tear arthritis, RA is an autoimmune disease. That means your immune system, meant to protect you, turns against the tissue lining your knee joint, the synovium. This silent sabotage triggers inflammation that builds up fluid, swells the knee, and erodes the cartilage that lets you move freely. But what makes RA in the knees uniquely dangerous for seniors isn't just the pain. It's what comes next. As the cartilage thins and bone surfaces grind, your knee can slowly lose its alignment. It might start to shift inward, buckle during steps, or feel wobbly when you turn. This isn't just inflammation, it's a breakdown of balance and stability. And for someone over 60, stability is everything. According to the CDC, 1 in 4 Americans aged 65 plus falls yearly. Knee instability is one of the top contributors. RA doesn't just make it harder to walk, it makes you hesitant to trust your legs. That hesitation slowly turns into fear, then inactivity. Muscles weaken, reflexes dull, and the very joints meant to carry you forward begin to hold you back. Early signs often go unnoticed. Morning stiffness lasting more than an hour, a deep ache behind the kneecap, or a sensation of pressure that comes and goes. Many dismiss these as part of aging, but the truth is untreated RA in the knees can reshape the joint itself, sometimes permanently. That's why understanding these early symptoms is not just helpful, it's urgent. In this video, you'll learn why protecting your knees now can mean walking confidently years later. Because the sooner you act, the more power you have over what RA takes from you. Next, we'll dive deeper into the hidden cycle behind these symptoms and how ignoring them leads to an even greater loss of mobility. Knee damage cycle. It often starts with something small. You wake up one morning, swing your legs off the bed, and your knees refuse to move. The stiffness is deep, not just tight muscles, but a locked joint that feels like it belongs to someone else. You wait, hoping it will pass. Maybe it loosens up a little after breakfast, but your confidence has already taken a hit by then. This is the classic morning stiffness of rheumatoid arthritis, especially in the knees. According to the Arthritis Foundation, this stiffness can last longer than an hour and is often one of the first signs of inflammatory joint damage. It's not just inconvenient, it's a warning sign. Then comes the swelling. Some days, your knee feels tight and warm. On other days, it balloons without warning, making it hard to bend, stand, or even find a comfortable position. These unpredictable flare-ups, when inflammation suddenly spikes, can leave you feeling helpless. You cancel outings, you skip errands, and slowly you start moving less, not more. But here's the trap. The less you move, the weaker the muscles around your knees become. Quadriceps shrink, hamstrings tighten, and the joint loses its natural support system. The knee starts to rely entirely on bone, cartilage, and damaged ligaments, exactly what RA is attacking. This muscle weakness also throws off your balance, making every step riskier than the last. Flare-ups cause pain. Pain leads to inactivity. Inactivity weakens support muscles. Weaker knees cause more pain and instability. Before long, walking across the living room feels like crossing a minefield. You hold onto the furniture. You avoid stairs. You dread the thought of falling. And it's not just physical. This uncertainty seeps into your mood. You stop trusting your legs. You say no to invitations, even when you want to say yes. The world feels smaller, and the smaller it gets, the harder it becomes to break free. But this cycle isn't unbreakable. In the next section, we'll show you how simple, joint-friendly exercises, done at your own pace, can help rebuild the muscle support your knees need. Because when you strengthen what surrounds the joint, you protect what's inside it. Knee exercises. For RA. When rheumatoid arthritis weakens the knee, it doesn't just hurt, it makes the joint unstable. That's why one of the most powerful ways to protect your knees isn't medication, it's movement. Specifically, a movement that builds strength around the joint without putting stress on it. Let's be clear, we're not talking about lunges or high-impact routines. The goal isn't to push through pain, but to reinforce your knees with steady, low-impact exercises that rebuild the muscle support system RA slowly erodes. One of the simplest and safest exercises is the straight leg raise. You start by lying on your back with one leg bent and the other straight. Slowly lift the straight leg to the height of the bent knee. Hold it for a few seconds, then lower it gently. This activates the quadriceps without compressing the knee joint, a crucial benefit for people with inflammation. Start with one set of 10 repetitions per leg, working up gradually as strength returns. Another joint-friendly move is the seated knee extension. Sit on a sturdy chair with both feet flat on the ground. Slowly straighten one leg until it's parallel with the floor. Pause briefly, then lower it down. Alternate legs. This helps maintain the range of motion and strengthens the quadriceps, the muscle group most essential for knee stability during walking and standing. If you're comfortable standing, mini squats can be added to your routine. Stand behind a counter or chair for support. Slowly bend your knees about 20 degrees, then straighten up. This engages both your thighs and your glutes and hips, key players in balance and joint control. Keep your movements slow and controlled, and never drop into a full squat. It's quality, not quantity, that builds strength safely. If you're unsure about starting independently, don't hesitate to ask your doctor or physical therapist for guidance. A personalized plan can make all the difference, especially if your RA has already affected your balance or coordination. Research from the National Institute on Aging confirms that strength training, even in small doses, improves mobility and prevents falls in seniors with joint disorders. The secret isn't intensity, it's consistency. 3 short sessions a week can help you regain control over your knees, improve your walking confidence, and make everyday tasks, like climbing stairs or getting out of a car, feel doable again. Next, we'll go beyond isolated exercises and talk about daily movement, walking, swimming, biking, and how to make these safe and sustainable even with RA in your knees. Because when movement becomes a habit, strength becomes your new baseline. Gentle movement. For knees, it's a common trap. When your knees hurt, you rest. However, too much rest leads to stiffness, weakness, and loss of confidence. The key isn't avoiding movement, it's choosing the right kind. For seniors with rheumatoid arthritis in the knees, gentle, consistent movement is one of the most effective tools for preserving mobility. According to the Centers for Disease Control and Prevention, CDC, regular low-impact physical activity can reduce joint pain, improve function, and delay disability, even in those with chronic conditions. One of the best choices? Walking. Yes, simple walking. It promotes circulation, lubricates joints, and strengthens the knee-supporting muscles. The key is to start slow. Begin with short walks on flat, even surfaces. Wear supportive shoes and use a cane for added stability if needed. Over time, gradually increase distance, focusing on consistency, not speed. Swimming or water aerobics is another top-tier option. The buoyancy of water reduces the weight placed on your knees, allowing you to move freely without aggravating inflammation. Water supports your body but provides gentle resistance, perfect for strengthening legs and improving balance in a joint-safe environment. Would you prefer to stay indoors? Cycling offers excellent joint movement without impact, especially on a stationary bike. Just 10 to 15 minutes a few times a week can improve circulation and help keep knee joints mobile. Ensure the seat is at the right height. Your knee should extend almost entirely at the bottom of each pedal stroke without locking. The beauty of daily movement isn't just in the physical benefits, it's also about the rhythm it gives your life. Movement creates momentum. When you walk each morning, swim twice a week, or bike every other day, your body begins to expect action. Your joints stay ready. Your muscles remain active. There's no need for sweat, pain, or long workouts. A few minutes of smart, gentle, daily activity can do more for your knees than a drawer full of pills. Combine movement with mindfulness. Check how your knees feel before and after. Please don't overdo it, and always pair effort with rest. In the next section, we'll explore another layer of support, literally. Knee braces, compression sleeves, and how the proper external support can reduce pain and keep your joints aligned while you move through daily life. Because when it comes to RA in your knees, staying active isn't optional. It's how you regain power, one gentle step at a time. Smart knee. Support. Even with the right exercises and daily movement, there are times when your knees still need extra support, and that's okay. The innovative use of external supports can differentiate between staying mobile and quitting activities you love. Knee braces and compression sleeves aren't just for athletes or injury recovery. They're powerful tools, especially for seniors with rheumatoid arthritis, because they offer something your body may no longer provide: stability. Let's start with compression sleeves. These are soft, elastic supports that slip over the knee. They don't restrict movement but provide gentle pressure that reduces swelling and boosts circulation. For many seniors, especially during flare-ups, a compression sleeve adds enough comfort to make walking less risky and more manageable. Then there are structured knee braces. These range from simple wrap-around models to hinged braces that guide the joint through a safe, supported range of motion. The best brace depends on your symptoms. Mild instability? A soft brace may be enough. More severe wobbling or joint misalignment? A hinged brace can help redistribute pressure and keep your knee moving in the right direction. According to the American Academy of Orthopedic Surgeons, braces can significantly improve joint alignment and reduce pain in arthritic knees, especially when combined with physical therapy. But the fit matters. An ill-fitting brace can cause more harm than good. Talk to your doctor or physical therapist if you're unsure which type to choose. They can help match you with the right style and fit for your body, activity level, and condition. Beyond braces, simple mobility aids like canes or walkers can be life-changing. Not because you're weak, but because you're smart enough to use the right tools. A cane on the opposite side of the affected knee can reduce joint load by up to 25%. That's not small. It's protection you can feel. And don't underestimate the power of shoes. Supportive, shock-absorbing footwear helps keep knees aligned and absorbs impact before it reaches your joints. A good pair of walking shoes can extend your range of movement far more than most people realize. Using support isn't giving in. It's taking charge. These tools don't replace your strength. They protect it while you rebuild. They give you confidence when sidewalks feel uneven. They let you say yes to an afternoon stroll instead of saying no out of fear. The following section will discuss managing pain smartly with warm compresses, topical creams, and supplements like glucosamine. Because when pain is under control, movement becomes freedom again. Smart relief for knees. Pain doesn't just slow you down, it changes how you move, rest, and relate to your body. For seniors with rheumatoid arthritis in the knees, pain is often unpredictable. Some days, it's a dull pressure. Other days, it's sharp, hot, and unrelenting. And while medications have their place, there are innovative, gentle strategies you can use to take back control, starting with heat. Heat therapy is one of the oldest and most reliable ways to ease joint stiffness and improve flexibility. A warm compress, heating pad, or even a 15-minute soak in a warm bath can increase blood flow to the knee, relax surrounding muscles, and reduce that deep, aching discomfort. According to the Arthritis Foundation, heat is most effective when used before activity, helping to wake up the joint and prepare it for movement. When inflammation flares, cold therapy can be your ally. An ice pack wrapped in a towel and applied for 10 to 15 minutes can help calm swelling and numb sharp pain. This contrast, using heat to loosen and cold to relax, is called contrast therapy, and it's surprisingly effective when done carefully. But pain doesn't always live deep inside the joint. Sometimes it lingers in the surrounding tissue, where topical treatments can offer fast, localized relief. Creams and gels containing capsaicin, menthol, or NSAIDs, like diclofenac, work by interrupting pain signals or reducing inflammation directly at the surface. Capsaicin, derived from chili peppers, slowly desensitizes pain receptors in the skin. It doesn't work overnight, but regular use can lower chronic knee pain over time. Menthol-based creams create a cooling sensation that distracts from deeper pain. And over-the-counter NSAID creams, approved by the FDA, deliver anti-inflammatory power without affecting your entire system. For many seniors, especially those already taking other medications, topical options offer pain relief without the side effects of oral drugs. Always read labels and check with your doctor before starting something new. Then there's glucosamine, a popular supplement often paired with chondroitin. These compounds are naturally found in cartilage, and some studies suggest they help slow joint deterioration and reduce stiffness. The research is mixed, but many people with knee arthritis report real benefits. If you're considering glucosamine, consistency is key. It's not a quick fix. Effects may take 4 to 8 weeks, and not everyone responds the same. It can also interact with certain medications, including blood thinners, so always consult your healthcare provider first. In the end, pain relief isn't about numbing everything. It's about restoring your ability to move without fear. When your pain is managed, your confidence rises. You engage more. You move more. You live more. Next, we'll look at another decisive factor impacting knee health, your weight, and how even a slight loss can make a big difference in pressure, pain, and long-term mobility. Weight and knee health. Regarding rheumatoid arthritis in the knees, one of the most powerful changes you can make has nothing to do with prescriptions or physical therapy. It's your weight. That may sound harsh, but the science is precise. With each step, your knees absorb about 4 additional pounds of pressure for every extra pound you carry. That means just 10 extra pounds can feel like 40 pounds of force, hammering your joints every time you move. Over weeks, months, and years, that pressure adds up, speeding up cartilage breakdown, increasing pain, and amplifying inflammation. But here's the good news. The reverse is also true. According to a long-term study by the Arthritis Foundation, losing just 5% of your body weight, even without extreme dieting or intense workouts, can significantly reduce joint pain and improve function. For someone weighing 180 pounds, that's just 9 pounds. A small, reachable goal that leads to real relief. This isn't about drastic diets or chasing numbers. It's about supporting your knees by reducing the load they carry, and nutrition plays a key role. Start by focusing on anti-inflammatory foods. Leafy greens like spinach and kale contain antioxidants that help calm immune overactivity. Fatty fish, such as salmon and sardines, provide omega-3 fatty acids, which studies have shown to reduce joint swelling and morning stiffness in RA patients. Nuts, seeds, berries, olive oil. These aren't trendy superfoods. They're tools in your daily toolkit for reducing pain. Conversely, reduce processed sugars, fried foods, and excess red meat. These foods can fuel inflammation and make it harder for your joints to recover after flare-ups. Instead of cutting everything at once, make one slight shift at a time. Switch soda for water with lemon, or replace a bag of chips with a handful of walnuts. Portion control matters too. Eating slowly, paying attention to fullness cues, and using smaller plates are subtle habits that make a big difference over time, especially for seniors who aren't burning calories as quickly as they used to. You don't need to aim for a model's weight. You need to aim for your knees' comfort. Every pound you release is a gift to your joints, and every healthy choice, however small, is a step toward reclaiming movement, confidence, and control. In the next section, we'll connect this to one critical issue: fall prevention. Because fewer pounds, stronger muscles, and better nutrition don't just make you feel better. They help keep you standing. Fall prevention and resilience. For many seniors with rheumatoid arthritis in the knees, the greatest fear isn't the pain, it's the fall. A single misstep can turn a moment into a medical crisis, and unfortunately, that fear is justified. According to the CDC, 1 in 4 adults over age 65 falls each year. Of those, 1 in 5 results in serious injury, a broken bone, a hospital stay, a long road to recovery. But fear alone doesn't keep you safe. It can do the opposite. When you're afraid to move, you move less. Your muscles weaken, and your balance declines, and your confidence erodes. You start to avoid the things that once brought you joy: gardening, outings, even short walks around the block. And little by little, your world becomes smaller, not because of RA, but because of the anxiety it builds. That's why fall prevention isn't just about technique, but reclaiming control. Let's start with the body. Strength is the best defense against falls, especially in your legs, hips, and core. You're already building this protection if you've been doing the exercises we discussed earlier. Try balance drills, standing on one leg while holding a chair, shifting your weight from side to side, or practicing heel to toe walking along a hallway. A few minutes daily can sharpen your reflexes and retrain your brain to trust your legs again. Tai Chi is another proven method. Slow, flowing, and focused improves balance, flexibility, and coordination while calming the mind. Studies have shown that Tai Chi can cut fall risk in older adults by nearly half. Then there's your environment. Simple changes in your home, like installing grab bars, removing throw rugs, adding nightlights, and wearing non-slip shoes, can turn a danger zone into a place of safety. Consider a handrail on both sides if your home has stairs, or limit use to one living level. However, the most overlooked fall prevention strategy is emotional resilience. You have to believe that you can move safely again, that you're not fragile, that every step you take is a statement of independence, not risk. Talk to someone, join a group, share your progress with a friend or family member because connection builds courage. And courage is what keeps your feet moving, even on uncertain ground. In the final section, we'll bring everything together, from movement to mindset, to show how staying mobile after 60 with RA isn't just possible. It's powerful, living strong. With RA. Rheumatoid arthritis in the knees can feel like a slow erosion of strength, confidence, and the freedom to live on your terms. But it doesn't have to be that way. You've seen how the pieces fit together, how understanding the disease helps you fight it smarter. How can targeted exercises rebuild support and stability? How daily movement keeps your body ready and your mind engaged. Braces, pain relief, and smart nutrition are silent reinforcements behind every step. and how staying balanced, physically and emotionally, protects not just your body, but also your dignity. The truth is, you don't have to accept decline as the price of growing older. You don't have to let pain write the rules. Every movement you make, healthy choice, and ounce of effort are not small things. They are acts of resilience, of power, of ownership over your life. RA may have changed your knees, but it hasn't taken away your will to move forward. So please put what you've learned here into motion. Pick one strategy today and start small. One leg raise, one short walk, one better meal. That's how progress begins, with movement. And movement at any age is a declaration. I'm still here, and I'm still moving. Thank you for watching. Stay strong, stay mobile, stay you.